Okay, this is an exciting slide because we're going to talk about some of the therapies that we do in the office, but it's also, I'm going to teach you a little bit about the nervous system and how it communicates with itself, okay, with the body to the brain. So you can see our spine here at the bottom, and there's these two arrows moving, okay? A little bit of neurology for you, okay? The nerves that bring the information from the body up to the brain is called the afferent pathway. Okay, there's specific nerves that gather the information, bring it up the spine, so the brain can have the information to make a decision about what we need to do. Based off of that information, the brain makes a decision and then sends communication down from the brain out, which is called the efferent pathways. The point of this is we can intentionally communicate to the brain by doing specific therapies, and some are better than others for different reasons. And so this is an important concept or information to have, not only from you as a patient standpoint, but also from the doctor standpoint of what type of therapies am I providing and when are the best ones. Because again, we're trying to deal with this moving target thing here, right? So the brain, a concept here I want you to think about is the brain can only respond to the information that it gets. Okay, so if the information from the body comes up through the spine and there's a game of telephone that the information goes through, it alters the message, the brain can only respond to that, which may not be the actual message that the body sent. And so the body's getting altered messaging or support from the brain. So by doing specific therapies like chiropractic, and not just any old go to the joint and rack 'em, crack 'em, roll you over kind of adjustment, we're talking about specific adjusting, again, too much or soft enough, right? Some of that goes into play here of we can actually over adjust the patient or adjust too many segments of the spine. And so it's important to know when and where, but acupuncture does great. Different light therapies, breath work, and vibrational therapies. So not all at once maybe, and maybe different combinations, but it really depends on the patient and what's going on to support their body and what they need and where.